Hey guys, today I want to talk a little bit about the Philippines' biggest budget buster. One of them anyway. The biggest budget buster over here, some people will say it's your family borrowing money or whatever, and that's not the biggest budget buster, by the way. That's probably one of the tiniest, at least in my budget it is, you know. Yeah, I pay a little bit extra for certain things in my family to help them out and stuff like that, but the biggest budget buster in the Philippines is healthcare. Okay, and I'm going to tell you why. Healthcare over here at first, if you're young and you're in your 50s, okay, is fairly reasonable. You can get away with the Peso plans over here and probably spend about $770 through Pacific Cross for inpatient care, probably up to about $1,000 or somewhere around $1,000 for inpatient and outpatient care, okay, for people less than 60. Maybe a little bit over $1,000, maybe a little bit under. It varies. I'm 57. I'm going on 58. I think I pay about $770 for outpatient. I'm going to get inpatient. I did have inpatient before. I believe it was like around $1,000 total. Okay, but as you age, okay, some of these plans they start changing, and when you reach certain age categories, it depends on which insurance you have. You have to get special insurance for people over 75. And the costs start getting prohibitive for some expats. Okay, so some expats just cut it off and say, well, if I die, I die, that's it. Well, sometimes you don't die, and you have a stroke, and you go home with a stroke, or you have a heart attack, and you still live, or maybe you have cancer and you're gonna live for a while. Things like that, you know? I mean, you gotta play it safe, guys. And it's one of the reasons why, you know, like I tell people to over budget and bring money over here that's at a higher level versus a lower level. But I understand some guys, some of the expats, you know, they went through divorces or they just didn't plan for retirement or whatever, and they have to live with what they have to live with, and that's the way it is. And some of those people, if you have health issues, it's better off to just stay home. I mean, I'm being honest, you know, I'm not gonna lie to you, you know, and like some would say, I'm brutally honest about it, you know. I would just tell people, if you're sickly, stay home, you know, because if you come over here on a low budget, low micro budget or something like that, less than $1,250, you know, you're gonna be hurting, and $1,250 is probably not gonna last you a long time over here. And it's the reason why I tell people $2,000 to $3,000 is the sweet spot budget, because you can put money aside for the future and you can replenish your emergency accounts. God forbid you gotta dip into it, okay? Emergency accounts are basically just to help you what insurance doesn't pick up, okay? Because some things insurance doesn't pick up over here. And also you got to have money to pay the hospital to leave, okay? And then the insurance will pick up the cost later on and reimburse you for most of that money, probably, if not all of it, depending on the insurance that you have. But as you age and you start getting up into this like 75, 80, you know, into that range, your insurance is definitely going to change, guys, you know, and start worrying, you know, look into it. Call these insurance companies that I've mentioned in the past, in my past videos. Ask them what it's going to cost for a 75 or 80-year-old over here, because that's what you're going to need to pay every year. And they start getting cost prohibitive. Now, I can't tell you what they're going to cost, so don't write in the comment sections, hey, Steve, what's it going to cost for a 75 or 80-year-old in the Philippines for insurance? I don't know, because each one is different. You know, it depends on which insurance company you go through. I mean, I can certainly get quotes and stuff like that, but I leave that up to you guys, because I've given you the information for those people and everything. And, you know, I highly recommend you call these people and start getting these quotes for older people, so you'll have a rough idea what it's going to cost. And don't forget, there's going to be inflation, guys, between now and then. So if you're 65 or 60 now, and you want to find out what it's going to cost later on for, say, an 80-year-old or a 75-year-old, then add some money on top of that, because it's going to cost more. And it's one of the reasons why, you know, I tell people to have a budget where you put aside money for yourself, for your emergencies, for family emergencies. If your kids get sick, your wife or girlfriend gets sick, you have to pick up those costs, guys. And, you know, just to be honest, you'd be a total dirtbag if your girlfriend got sick or something like that, seriously sick, or your wife and you didn't pay for it. And a lot of guys say that they want to come over here and they want to meet a girl or something like that, but they only think about themselves. You hear what I said? They only think about themselves. Guys, seriously, we need to think about the ones that are taking care of us too. And most of these girls are taking care of the older guys. They're looking out for us. They're decent people. They love us. So why wouldn't you want to love them back by taking care of them and having some sort of health insurance for them? My girlfriend, I pay for Phil Health, okay? And I put a little bit of money aside each month for her to put aside. God forbid she gets sick, and then she needs that money. Because if she needs that money, she's going to use it up quick. So I put a little bit of money aside for her so that it's kind of like a self-insurance policy on top of the Phil Health. Because Phil Health might only cover 20%, might cover 50%. You don't know. It varies on each item that they cover, I guess. This place is like Rooster Heaven now. I guess the people that run the place, whoever took it over, they use the dog pound now for roosters. I'm going to have to talk with the mayor about it because I don't think she knows what's going on down here because they hold weddings here and there's just roosters everywhere. It's worse than the dogs almost, But anyhow, guys, just listen to me on that about the insurance. And here it goes again. Listen to me about, all these different things, guys. Play it safe. I just want everybody to be safe here. And I mean, you can listen to these guys that come over here that didn't plan for their retirements, and they're living on the lower retirements, so they couldn't retire in the United States. So they come over here and, I understand. I'm not slamming these guys. I actually, have a place in my heart for these guys because I know this is their last resort, their last choice. But some of these guys had choices back home too, because they could have got low-income housing or things like that back home and probably got some sort of money for food or whatever back there and got some help and got health care. And some of these guys that are coming over here, their health care, they're not going to get the same health care here as back home in some cases. Depends where you are too. Depends which island you're on, which hospital you use, things like that. So I just implore you guys, play it safe. Think about some of the things that I say on here. And I'm not trying to teach you or anything. I'm just trying to, tell you the lowdown on what's really happening over here. And the lowdown is, you need money. You need money to play it safe. And if you don't have that money, you're not going to be safe. Okay? And God forbid you guys have an accident, in a car or something like that, or, and you have to go to the hospital and you don't have any coverage, or you kill somebody in a car, over here, you're going to need liability insurance if you have a car. And that's why I don't recommend having cars over here, by the way. Some people were asking me, can you get insurance? Yes, you can, but it's not that great. Okay? The question is, will they pay too? And some of them might say, well, we're not going to pay for that. So you just don't know. I mean, it's kind of like that back in the States, but most of the time back in the States, they pay because there's insurance, overseers in the government that oversee that. But over here, it's a little bit different. But anyhow, guys, God bless. I hope you enjoyed today's show. Just something to think about, mull over in your head and, think about what's going to happen in your future. Is it worth it for you to come over here? Is it worth it? Do you have enough money? Is it going to be safe enough for me? But anyway, guys, God bless. Take care.